Let's get straight into it then. A number of people have taken ill in the province in the last few days with suggestions that there's been Salmonella, an outbreak in the area. Can you confirm this?
I haven't denied anything. Thanks for this opportunity to explain to our viewers what actually is the situation. In a particular restaurant here in the province, people went in there and ate food which allegedly made them to feel unwell, and therefore went to a private hospital and were seen there. Now, yes, you would call it an outbreak because, one, it's actually something that has happened to two or more people. That's a definition of a similar condition happening to two or more people that have been in a similar place. Then you can call it an outbreak. But this is very limited, and it's not really been an issue for reporting for the following reasons. One, what has been found there, is not Salmonella typhi, which is a notifiable disease, but it is a particular Salmonella, which is a non-typhoid. Therefore, you don't report all bacteria that are not even causing a life-threatening. So it's a Salmonella typhi, which is a cause of concern. But on the patients who were admitted in a private hospital, of course, we thank the NICD, which is the National Institute for Communicable Disease and Center for Disease Control, which then followed up these patients in a private hospital and found that they had something which was actually infected their food from a restaurant, which is not the Salmonella that is life-threatening. Now, we do not have any other incidents in the province except for another incident that was reported in October in a particular crash in Cows Hill, where children just became unwell in a crash and had diarrhea and this and that. Now, that is not really something that we know of, because samples were also not taken from those children. It's something that was reported later on. But this one, there has been an information about the salmonellosis, not caused by the Salmonella typhi, therefore not a notifiable disease.
So your message then to the people of KwaZulu-Natal is what, Dr. Dhlomo? Not to worry. This is not the Salmonella that is linked to, in terms of its genesis, the human excrements, perhaps food coming into contact with that, and perhaps the mishandling of that in a city setting, for example.
Exactly, Tula says that what actually transpired in that restaurant is something that actually has not caused an alarm, but it is a wake-up call to say all food handlers in the province, because even if it was Salmonella typhi, it's an oral fecal transmission. You go to the bathrooms and you come back with your hands not well cleaned, and you touch the food and you serve people. That's how you actually could transmit the disease. So this time around, it is a wake-up call to say to all of us, one, you must probably, those who are food handlers, make sure that you handle food after thorough hand washing. But number two, we also need to all adhere to hygienic programs in the province and in the country. But number three, we should also maybe encourage all of us to eat real cooked food, not half-cooked, especially when we are not going to actually be sure of the source. In that way, that is how we also got listeriosis, where food was actually not handled properly, and hands and the feet and the feces. So this time around, we are lucky that it was one source that was identified. Number two, it was not a Salmonella that causes the serious illnesses and the concern. But number three, it's a wake-up call for us.
Right. Because of time, Dr. Dhlomo, let me move very swiftly then to the issue of oncology. You've been saying as a department and a government in KwaZulu-Natal, the oncology crisis is under control and you're basically making progress. But the people that observe, various observers are saying that that's completely not true, with the result that you have people waiting for up to 6 months, for them to actually, women, for example, getting mammograms mammograms. We are told that, chemotherapy has come to a halt at Addington Hospital, and things are not moving well at the Inkosi Albert Luthuli Hospital. Put us at ease then. What is the situation in as far as oncology and access to chemotherapy is concerned?
Yeah, no, thanks to us. Those are incorrect. Those are incorrect reports. Number one, we have the 7 linear accelerators in the province. That is what actually was. We had 7 now. We had 7 linear accelerators in the province, which actually makes us to be on par with Gauteng, and that is something that has happened just 3 months ago. Number 2, we have continuously a supply and the support of 3 oncologists at Inkosi Albert Luthuli, which actually is a Vets Health Consortium PPP. We have 2 working machines at Addington Hospital, and we have 2 of our own oncologists. Recently, we are joined by Dr. Lusu, who has just completed her training. At Ngwelezane Queen Nandi, we have another PPP with JMH, where there's also a machine there. The issue that, and the Grace Hospital has never had a problem. 4 oncologists, now reduced to 3, but the machines have always been working there. You probably recall that 2 weeks ago, the Minister of Health came to launch a cancer campaign in KwaZulu-Natal, and among other things he did on that day was actually to give us new machines called large loop excision transformation zone LEDs. And those machines are about 100 now in the province. Those machines are almost like a cure for early cancers. What then we had, which we wanted to dispel, was that there's just one chemotherapy drug, which is a shortage, not just in KwaZulu-Natal, but in the country. And the minister is handling that part very well. This drug is short because of the manufacturer, not because we didn't buy or didn't have money. So it's just one drug which is usually used for cancer of the breast. So its shortage is as a result of the manufacturers.
Right.
Number 3, I am not informed that you only use mammogram to diagnose breast cancer. Sometimes you use a biopsy, and we are wanting to be educated by our oncologists and other doctors. If there is going to be a long waiting time for mammograms, why don't we then resort in other patients being exposed to biopsies of those lumps that they pick up? That can also be another way of early diagnosis and early treatment of cancer.
Thank you so much.
The waiting times in the province has been significantly reduced.
Dr. Dhlomo, thank you so much for your time. We really appreciate it. Completely out of time, but we had to touch on this, which is a critical issue in as far as the healthcare system is concerned in KwaZulu-Natal. That is the MEC of Health in KwaZulu-Natal.